this chapter name renal and urinary medication. In this PowerPoint, we only going to focus in renal pharmacology. What are the medication we use in different kind of urinary disorder? Before to start, in this flow chart, you can see the structure of urinary system. This is the anatomy of urinary system. That we have two kidneys, right and left, and this it is called pelvis, where the artery get in and vein get out from the kidney. And you know the kidney work as a filter of the blood. They remove the waste materials and also reabsorb the materials what we need. The top of both kidney, a gland is called suprarenal gland. And the ureter came out through the renal pelvis, and ureter right and left meeting point in the urinary bladder. So when urinary bladder is contract, the urine is expelled out through the urethra here. So kidney formation the urine, and urine is conveyed or passing through the ureter and accumulate reservoir in the urinary bladder and passing through the urethra. In this PowerPoint, basically we are going to focus what are the medication commonly we use in case of different kind of urinary disease, right? As example I said, like infection occur in urethra or urinary bladder or ureter, we call UTI or urinary tract infection. But when infection or inflammation in urethra, we call urethritis. When infection or inflammation in urinary bladder, we call cystitis, right? When infection in the ureter, we call UTI or urinary tract infection. When infection in the kidney, we call pyelonephritis, right? Kidney also common disease is called glomerulonephritis, acute or chronic kidney disease. Now here, the urinary tract antiseptics or antibiotics. What are the antibiotics we use in case of infection in urinary system? Urinary tract antiseptic basically inhibit the growth of bacteria in urine, act as the disinfectant within the urinary tract. So antibiotic or antiseptic basically inhibit the growth of bacteria and act as a disinfectant the urinary tract. So antibiotics we use for acute cystitis, is the inflammation of the bladder. Basically, we use ciprofloxacin or phenylzopyridine, or urinary tract infection or UTI. Urinary tract antiseptic do not achieve effective antibacterial concentration in blood or tissue, and therefore cannot be used for infection outside the urinary tract. in this picture, we can see the structure of urogenital organ, and here we see this is the rectum, and this is vagina, and this is the bladder. So UTI is more common in female because the shortage of the distance between opening of rectum and opening of urethra. So infection easily can spread from rectum to urinary urethra. So it is showing, bacteria here, then spreading and get in through the urethra and inflame the urinary bladder and develop cystitis. In this picture showing, when bacteria come, the bacteria has a pilus or hook through they get inside the epithelial cell. Inside the cell, they duplication or replication, multiplication, and finally some of them get out, we call efflux, again get in, and again multiplication. Finally, they get inside the urinary bladder and developed inflammation of the bladder, we call cystitis or urinary tract infection. So what are the medication? Basically, we use as a urinary tract antibiotics or antiseptics. We use amoxicillin or cefixime or phosphomycin and also nitrofurantoin. So amoxicillin is most common drugs. All of you know about this. It is antimicrobial. And amoxicillin is a broad spectrum penicillin. And also penicillin itself, but they are narrow spectrum. This amoxicillin can kill the gram-positive and gram-negative bacteria, especially gram-negative bacteria, right? So as you know, if your patient have a allergy to the penicillin or allergy to cephalosporin, we better do not give amoxicillin. So do not give patient to allergy to penicillin or cephalosporin. Second one is called cefixime. Cefixime. This is the antimicrobial we use for any kind of gram positive or gram negative organism, but sometimes cefixime can cause GI upset or super infection like yeast infection. Another medication we use is called nitrofurantoin, right? Nitrofurantoin also most common drugs we use as a urinary tract infection. But nitrofurantoin can cause GI upset as well, or their hypersensitivity, or can develop blood dyscrasis. Important to know. Now go in details. What are the side effects of each and every medication and what are the nursing consideration? For phosphomycin, basically the medication is available as granules that must be dissolved, and also instruct the client to mix the content of a package is about half cup of cold water. and also medication that increase the gastrointestinal motility and reduce the absorption of phosphomycin. And another drug is called methenamine, used to treat the chronic urinary tract infection, but not recommended for acute infection. So if anybody repeated infection, we use the methenamine. Administer after the food or meal or at the bedtime to minimize the GI upset. So nausea, vomiting, or sometimes diarrhea is common as a side effect. Chronic high-dose therapy can cause bladder irritation. And what continue? So decomposition of medication generate ammonia, and therefore it should not be used for client with a liver dysfunction. So before give this medication, it is good to know the liver function test. So if patient has a liver problem, chronic liver disease, it is good not to give. And also it is this medication require acidic urine, and pH supposed to be 5.5 or lower. So because 5.5 is the acidic pH. And also increase the fluid intake, reduce the antibacterial effect by diluting the medication and raising the urine pH. Methenamine should not be combined with sulfonamide because the risks of crystal urine or urinary tract injury. So sulfonamide or sulfamethoxazolone is a very strong antibiotics. The client taking this medication should avoid alkalizing agents, include over-the-counter medication or antacid containing sodium bicarbonate or sodium bicarbonate alone. It is good to avoid. Now go for nitrofurantoin. So gastrointestinal effect include anorexia, nausea, vomiting, and diarrhea. So if your patient take furantoin for urinary tract infection or as a urinary tract antiseptic, it is good to tell your patient the side effect. And side effect is the GI upset like nausea, vomiting, anorexia, or diarrhea. And sometimes the nitrofurantoin can cause hypersensitivities or blood dyscrasis. And some of the patients also complain the peripheral neuropathy or brown discoloration of the urine during the treatment. It is good to tell your patient, so they will be prepared about the side effect. So pulmonary reaction include shortness of breath, dyspnea, chest pain, chill, fever, cough, or alveolar infiltrate. And this resolve in 2 to 4 days following cessation of treatment. So you do not need any extra medication to subside this side effect. It will be automatically stopped. Hematological effect include a granulocytosis or leukopenia, thrombocytopenia, or megaloblastic anemia. So a granulocytosis means the absence of WBC. Usually patient complain of infection like fever or WBC go down, white blood cell go down. We call leukopenia. or platelet go down, we call thrombocytopenia. And also patient develop megaloblastic anemia, hemoglobin go down. And when a patient WBC, platelet, red blood cell go down, all together is called pancytopenia. Peripheral neuropathy effect include muscle weakness, tingling sensation, and numbness. The neurological effect include headache, vertigo, drowsiness, and also nystagmus. Allergic reaction include anaphylaxis, rash, or tingling sensation around the mouth because of nitrofurantoin. Nitrofurantoin may impart a harmless brown color of urine, or nitrofurantoin is contraindicated in client with a renal impairment. So if the patient kidney does not work, it is good not to give. So before start the nitrofurantoin, we could check the serum creatinine and BUN, blood urea nitrogen level. The client is instructed about the expected side effect. What sign you see, and we could notify the healthcare provider if we see patient have any kind of hematuria or infection sign, fever, chill, or not to take nitrofurantoin with antacid. Another medication we use for renal patient we call fluoroquinolone. Fluoroquinolone, they suppress the bacterial growth by inhibiting the enzyme necessary for DNA synthesis for bacteria. So bacteria need DNA. So if you break down the DNA synthesis, bacteria will die. And active again a broad spectrum of microbes. So fluoroquinolone are the strong antibiotics. They can kill gram-positive and gram-negative organism. So like ciprofloxacillin or levofloxacillin, moxifloxacillin, right, or ofloxacillin or getifloxacillin. So this is the names of drugs or names of fluoroquinolone we use for urinary tract infection, or we use as a urinary antiseptic. So used for treatment the infection, right? So in the picture you can see this is the showing ciprofloxacillin, shortly called Cipro, or any medication in fluoroquinolone or fluoroquinolone itself has a common side effect. They can cause tendonitis or tendon rupture. In the picture you can see tendon Achilles is ruptured. Here we can see some NCLEX tips. So fluoroquinolone can cause dizziness, drowsiness, gastric distress, diarrhea, vaginitis, nausea, and vomiting. What are the other adverse effects, including psychosis, hallucination, confusion, tremor, hypersensitivity, and intestinal nephritis? But out of all, the tendonitis or tendon rupture is most important because NCLEX board asks. Other sign symptoms by fluoroquinolone are nausea, vomiting, diarrhea, means GI upset. Sometimes patient present with rash, increase the liver function test or photosensitivity, and some of the medication increase the effect of fluoroquinolone. It is good to avoid fluoroquinolone with those medication like theophylline, coumadin, caffeine, steroid, or diuretics. So with fluoroquinolone, there is an increased risk for tendonitis or tendon rupture. The Achilles tendon is most often involved, but the shoulder and hand tendon can also be affected. The client at the increased risks are those over the age of 60, those who taking corticosteroid, and the client who have undergo the organ transplant. So when patient take the corticosteroid or steroid, you give them fluoroquinolone, but steroid can increase the effect of fluoroquinolone, and also patient age can lead to rupture the tendon Achilles tear. What are the other medication cause same thing like fluoroquinolone with cardiac medication like quinidine or amiodarone, even anticoagulant like coumadin can increase the effectiveness of fluoroquinolone. What others? Fluoroquinolone should be used with some precaution in client with hepatic, renal, or central nervous system disorder. So kidney function test important, liver function test is important, right? So if your patient take fluoroquinolone, we could monitor the client for side effect and adverse effect. One of the fluoroquinolone is ciprofloxacin or sin, or levofloxacin, ofloxacin, or even moxifloxacin, levofloxacin, and ofloxacin may be taken with or without food. Intravenously administration ciprofloxacin and ofloxacin are infused slowly. It is the NCLEX question. Slowly over 60 minutes to minimize the discomfort and pain irritation. The client is advised to report dizziness, lightheadedness, visual disturbance, increase the light sensitivity, and feelings of depression, because this sign could indicate central nervous system toxicity. So what next? So the client is informed the sign of hepatic or renal toxicity. And also it is important to report this sign to the healthcare provider. Also avoid the ultraviolet light and sun exposure using the protective cloth and sunscreen. Fluoroquinolone are administered with a full glass of water, and the client is, if your client took the fluoroquinolone, it is good to check their blood level and also tell them to take enough fluid intake. So if patient take enough fluid and too much pee, and this pee can excrete out the antibiotics and minimize the development of crystal urea. So let me recap it. So this group of drug can cause photosensitivity. So educate your patient to avoid the sunlight, right? And also this fluoroquinolone we can use for bacterial infection. Even we use it for respiratory anthrax, or most common use is urinary tract infection. What are the next medication? It is called sulfonamide. So this suppress the bacterial growth by inhibiting the synthesis of folic acid. Also active again a broad spectrum microbes used primarily to treat acute urinary tract infection. So there are 3 points we learn from here. Sulfonamide is a broad spectrum antibiotics. They effective against gram-positive and gram-negative organism. And sulfonamide drug of choice to treat acute urinary tract infection. They inhibit or suppress the bacterial growth by inhibiting the synthesis of folic acid. It's an important component of bacterial wall formation. The sulfonamide, there are 2 groups of drugs. One is called sulfadiazine or trimethoprim sulfamethoxazole. This antimicrobial medication we use for severe urinary tract infection. The most common side effect, they can cause hypersensitivity reaction, include rash, fever, and photosensitivities. So educate your patient if they take the sulfamethoxazole trimethoprim, better to avoid the sunlight. They have a chance to develop hypersensitivity like skin rash, fever, or blood dyscreasis. So if patient develop blood dyscreasis, it is important to monitor the complete blood count or CBC. So this says sulfonamide can cause hemolytic anemia, agranulocytosis, leukopenia, and thrombocytopenia. WBC go down, leukocyte go down, platelet go down. We call blood dyscreasis. So if you count CBC, you can find it out. And the client is instructed to notify healthcare provider if they have a sore throat or fever. It indicates WBC go down, leukocyte go down because of they develop agranulocytosis or leukopenia because they took the sulfamethoxazole or sulfonamide. Most important here, sulfonamide sometimes cause very bad hypersensitivity reaction we call Steven-Johnson syndrome. In this picture, both picture you can see the hypersensitivity reaction because of sulfonamide, and they produce symptoms that include widespread skin rash all over the body or mucous membrane. You see the mucous membrane inside of the mouth, it get involved. Patient develop fever, malaise, and toxemia. Sulfonamide are administered with some precursor for the client with a renal impairment, right? So this, if your patient takes sulfonamide, you tell them to take enough fluid intake to avoid the crystalluria. So increase the fluid intake to avoid crystalluria. Sulfonamide are contraindicated if hypersensitivity exists to sulfonamide or thiazide or loop diuretics. Sulfonamide are contraindicated in infant younger than 2 months or pregnant women or mothers who are breastfeeding. Sulfonamide can potentiate the effect of warfarin, phenytoin, or orally administered hypoglycemic like tolbutamine. So if your patient take phenytoin antipsychotic, or if your patient take hypoglycemic agents like tolbutamine or blood thinner warfarin, it is a chance to drug-drug interaction. Next here, we could re-educate or re-inform instruction to the client to take medication on empty stomach with a full glass of water. So chance to increase the absorption. Reinforce instruction to the client to complete the entire course of prescribed medication. Also re-educate the instruction to the client to avoid prolonged exposure to the sunlight. As I told you, they can cause photosensitivity. Better to wear the sun protect lotion and also protective clothing. Adults should maintain a daily urine output at least 1200 ml by consuming 8 to 10 glasses of water every day. So they minimize the risks of renal damage, and also they minimize to develop the crystalluria. The client is informed that some combination of medication of sulfonamide can cause urine turn dark brown or red. Sulfonamide combined with a trimethoprim, we call trimethoprim sulfamethoxazole or sulfamethoxazole trimethoprim. When these two drugs combination, they're more effective than single one. And they inhibit the steps of bacterial folic acid synthesis. Very strong antibiotics in case of severe urinary tract infection. Trimethoprim sulfamethoxazole is used with precursor with the client would experiencing impaired the kidney function, folate deficiency, severe allergic or bronchial asthma. As intravenous dose of trimethoprim sulfamethoxazole is administered over 60 to 90 minutes. So it is good to admit slowly and is not mixed with other medication. Sulfonamide should be with hold if a rash is noted. The client is informed to contact the healthcare provider if rash appears. So here we can see the urinary tract analgesic. So if any pain occur in the urinary tract, the pain medication we call analgesia. The urinary tract analgesic is administered with an antibiotics because the analgesic is only treat the pain, not the infection. For infection, we use antibiotics. For the pain, we use the analgesic. The most common analgesic we use in urinary disease is called pentosane polysulfate sodium or phenoxypyridine. In this picture, you can see lateral view, kidney, ureter, urinary bladder, urethra. So if infection occur in urethra, patient develop urethritis. If infection urinary bladder, cystitis. If infection occur urinary tract, we call UTI, urinary tract infection. If it is not treated, the infection go retro direction from urethra, bladder, from bladder to ureter, ureter to kidney, and patient develop pyelonephritis. So in all cases, sometimes patient present with the pain and we give them analgesic, right? So what are the common side effects of urinary tract analgesic? They can chance nausea, headache, and vertigo. The nursing consideration, the client with instructed that the urine will turn red or orange and also strain the clothing, tear, and also in contact lens will also become red or orange color. So if you give the urinary analgesic, it is important to tell your patient about the side effect. The urinary tract analgesic is contraindicated in the client if the patient have a renal impairment or liver disease. So before to give, it is good to check the renal function or liver function. And this medication interact with the accurate urine testing for glucose and ketone. So if you check glucose or ketone, the chance to get the false positive in urine test.